Hello, everyone. My name is Ann Mangelsdorf, and I am your host for this evening. Welcome to this evening's webinar entitled SSI and Medicaid for Minor Children. Now, I have the pleasure of introducing Kristen Rusbarski, aka Rolf, who is our benefits coordinator. I'll turn it over to you.
Hello, everybody. Yes, I still have to change my Zoom name. Um, but my name is Kristen Rolfe. I recently got married. Today we are going to talk all about our little people. We're going to go through SSI and Medicaid and just some tips and tricks on filling out those SSI applications and Medicaid applications and just the background behind all of that. All right, so we're going to start today with benefits for children 17 and under. So 18 is that magical age where even if a child is still living at home, they are then considered an adult. So we're talking today all about our little people under 17. We're going to chat a little bit about the definition of a disability through Social Security. We're going to look at SSI applications and some things about filling those out, Medicaid insurance, and then Medicaid waivers. Those Medicaid waivers can help you get some funding for different therapies and respite and a few other items as well. So let's start with Social Security's definition of a disability. SSA, Social Security Administration. So we're going to use SSA a lot throughout the presentation. So that's going to be Social Security Administration. Their definition of disabled is a little bit different for children than it is for adults. For children, he or she has a medically determinable physical or mental impairment or a combination of impairments, and the impairment is marked in a severe functional limitation and has been expected to last for at least 1 year or result in death. So with that, we want all three of those pieces do have to be in place. So Social Security, when you go in to apply for disability benefits, they're going to look at all three of these points and see if they're all in place for the person that, for the child. So what this means, like I said, they need to be able to see, Social Security needs to be able to see how the person's disability affects their learning, social, and emotional functioning. So use those teachers, use those doctors, use those therapists to show how areas of their life how areas of your child's life is affected in every different aspect of what they're doing. So when they're at school, when they're at therapy, how is their daily functioning life being affected? Social Security needs to see evidence from these licensed personnel, doctors and therapists and teachers to meet the definition. So with an adult, they're going to look at whether or not an adult can work at a gainful, they call it substantial gainful activity, at a gainful amount to make a living for themselves. For a child, obviously, they're not working, so Social Security can't determine that. So they're going to really utilize those doctors, therapists, teachers to see how your child, how their disability is affecting their day-to-day life. So lean on them and really encourage them to fill out those sheets as Social Security sends them. And we'll talk about that in just a few minutes. So examples of what Social Security will want to see, how the child learns, acquires, and uses information. So, a lot of that's going to be in that, in school day-to-day, how they interact with each other. Are they playing with somebody? Are they playing alongside somebody? What does that look like for that person? Can they move and manipulate objects? What is their health and physical well-being like? And they'll use that information to determine that disability. From time to time, I don't think they've been doing it in the last couple of years with COVID. I've only seen one or two. But from time to time, Social Security might get all the documentation they need and then decide they want a little bit more information, and they might request a personal in-person evaluation. And at that point, it's going to be similar to a lot of that documentation that you've been sending in, but they just want to meet the child and ask questions and play and see, what is going on in their functioning level there. So this website here is going to pull up that definition of the disability, which is right here. So the definition of disability for a child, like I said, that physical, mental impairment, severe functional limitations expected to last at least a year or result in death, and then goes more in depth of the pieces that I said here, just defining what they're going to look at, what a licensed physician is, all of that. So this is a great little web page on the Social Security website to kind of help you know what to look for before you're going into that disability review. And these links here at the bottom, just copy and paste them into your web browser and they'll come up that way. Your doctor has, said that your child does have a disability. They have documentation. You want to fill out the SSI application to get them benefits for Social Security. So we're going to talk a little bit about that. So for most of the children, they're going to be applying for SSI benefits, which is Supplemental Security Income or insurance. It's used kind of interchangeably. So they're most likely going to get SSI benefits. We're not going to talk too much about them today. There are instances where a child could get SSDI benefits, Social Security Disability Insurance, and that typically will be off of a parent's work history and the parent's Social Security benefit themselves. So we're not going to touch too much on that. I think for most children, the SSI is going to be the more prevalent one. So we're going to start out flat out. It is a very tedious, time-consuming process to fill out the application, to go through all of the steps, but in the long run, it will benefit your child. And I also encourage, even if you think that you may not be eligible, maybe you think you make too much money, maybe you think that maybe your child's disability isn't as prevalent as you think it is, I do encourage people to at least try, because you might be surprised and you might be able to get that benefit coming in. So it's important to show how much support your child needs rather than their strengths, and that can be tricky. So we really want to show what your child needs support with, the parts of their life that they're lacking that development in. So often, and it's great and easy to talk about all their strengths and the things they do well, and we want to encourage those and embrace those. But for Social Security and for those benefits, we want to show what they need that support in, and how that part of their life needs that extra benefit to come in. Make friends with your doctors, make friends with your school personnel, let them know that Social Security will be contacting them for documentation. And then use the Social Security website for steps on how to apply. So we're going to flip back over to that really quickly. I have 3 PDFs that Brianne will be sending out that kind of go step by step through the process of information gathering, the process of the actual applying for benefits, what that looks like, and then just a checklist of pieces and a worksheet for schools or doctors to fill out. Okay, so here is our website for filling out that SSI application for children. And this it walks you right through how to do it. For SSI for a child, it will start online. So you're going to start by going through and filling out some information online. But the actual interview is going to be done over the phone. So once you fill out and submit the online portion, Social Security will contact you. Just a general rule of thumb for everything Social Security related. Social Security is never going to call. Well, very, very rarely they'll call. They might call and say, hey, you've been sending this in, we need this, and that would be okay, but they're not going to call and ask for a lot of information unless it's an appointment that's been scheduled. Just to be aware of like scammers and things like that. But typically Social Security is going to communicate through the mail. like I said, unless there's an appointment already scheduled, very rarely will they call or email. So they'll set up an appointment for you. You'll call, you'll do an interview over the phone. If your little one can be there alongside it, that's helpful. But also a lot of times, that's not really applicable. And so they'll go through and ask you questions about your child. And then towards the end of it, they're going to send you releases that you'll send back to them, and they're going to use those releases to send documents out to your doctors, therapists, teachers. So although I will show you a little worksheet for those medical personnel to fill out, Social Security is going to be the one to send essentially a release to them, and then they're going to send some documents for them to fill out. So that is a huge step that I think sometimes, when people say that, oh, you're always going to get rejected your first go around, it doesn't have to be that way. I think the big thing that the big reason why people get rejected that first go around is because whomever those documents were sent to maybe didn't send them back in the right amount of time, or maybe didn't send them back, period, or maybe didn't receive them. I don't know. So just make sure that the people who you want to fill out these documents for your child, make sure that they know that they're coming, and make sure they understand how important it is. So this goes through just a checklist to go through before that disability interview. So these are all items that we'll want to make sure that you have access to and that you have readily available if Social Security were to request them. So basic medical information, doctors, therapists, hospitals, any medical records you already have. So maybe your child has gone through all of the testing for autism spectrum diagnosis, and you have all of that. So any of those medical records that you already have, make sure you have those on hand. List of medications, other information, names, addresses, and phone numbers of all of the past schools, an IEP. If there's an IEP in place, that's even more helpful, because already the schools have shown that he or she needs that extra support. So we want to make sure we have that IEP, any caseworkers or extra support that the child has. If there's even a babysitter who might come in, or somebody you might have come in the morning to help get everybody ready. All those are helpful as well. Names and addresses there. Things that Social Security will most likely require: certified copy of the birth certificate, probably a Social Security card, proof of income. That's not necessarily going to apply to the child, but it will apply to the family members living in the household. And we're going to talk a little bit about deeming, which is when Social Security looks at the income of the other family members and applies that to the benefit. So there's that medical piece to show that the child needs that extra support, that extra benefit. And then there's that financial piece to show that the financial need is there as well. And we're going to go through just this easy high-level example of what Social Security looks at when they deem income from the parents. They don't look at your entire gross monthly income, and we'll talk about that in a couple of minutes. So that's an easy checklist. Like I said, you'll get a copy of this. It is also online for you to look through prior to that interview. Here we have just a couple things before you even go in and apply for those SSI benefits. This sheet kind of just goes through that definition of the disability through Social Security, and just the process of it, how long it takes Social Security to determine that disability is there, what the definition is, and how to actually go through it. So like I said, starts online, and then it finishes on the phone, and then with those different documents from the schools and doctors. So this is what I was speaking of with the worksheet for doctors and for therapists and teachers for them to look at. A lot of it you can pre-fill out. Things that the teacher might need might be able to help you with is how your child's activities are affected, current grades if you need it, testings that the school has done. Like I said, a lot of it the parent might be able to fill out, but it's also helpful to have the teacher's input because that also puts it on their radar to know that something else is coming for them to fill out. And that's going to come from Social Security. So it's a 3-page little worksheet, just asking different information about teachers' names, doctors' names, therapists' names, and all of that as well. And it's more of a tool for you to make sure that to help you have all that information right in front of you. So when you do get those releases sent over from Social Security, you have it there, fill it out, send it right back, and Social Security can get on with their part. So that's our gathering documents for the Social Security, your SSI app. So we're gonna start it online. We're gonna get all those medical tests, all those, the birth certificate, the Social Security card, anything else that maybe the doctor has given you, any of those medical records, and have that all ready to go for that phone interview. And then once you do the phone interview, Social Security will send a release for you to sign so they can get information from all those extra personnel. So like I said, we're going to talk, that's all your medical, that's your medical chunks there. So now we're going to flip over and talk about the financial piece. I think sometimes this might might scare people, just for lack of a better word right now, from that application, because they might feel they make too much money, and so therefore don't apply for those benefits. So deeming is what Social Security, their process for counting parents' income when determining that eligibility. So for SSI, here's just a general rule, and then we'll look at an example on the next slide. So Social Security SSA will look at the gross monthly income of the parent. So if it's a one-parent household, they will just look at the gross monthly income of that parent. If it's a two-parent household, gross monthly income of both parents together. If it's a step parent that's living in the house, same thing. They're going to look at the gross monthly income of the parents in the home. So for however many children you have who do not have a disability living in the home, Social Security is going to start by subtracting $420 for each of those people. So on our next example, just to keep it easy, I have it as a 2-child home, but if you have a 3-child home and 2 of them have not been diagnosed with a disability, and you have 1 who has, they're going to subtract $840 from that gross monthly income before they even count anything. So that's what the ineligible children is. So that's the children without the disability in the home. From that, they're going to, Social Security will subtract $85. That is a general income allowance that Social Security subtracts really from anytime they're determining a benefit amount for the month. So even for somebody who is working, they always subtract $85 right away before doing any of their other math. After that, they're going to take that number and divide that by 2. So we've already subtracted $420 from your gross monthly income for any children who do not have the disability. We subtract 85, we divide by 2. So that remaining amount, we're going to subtract an allowance for the parent. So if there's just 1 parent in the household, Social Security will subtract $841 from that amount. If there's 2 parents in the household, they're going to subtract $1,261, $1,261. And these are all 2022 amounts. So they do change yearly based on the COLA for the year. So after we subtract that amount from the gross monthly income, the remainder is the amount that Social Security deems for the child. So if it's less than the federal benefit rate, so if it's for 2022, the federal benefit rate is $841. So that means that's the highest amount of money that somebody with SSI benefits is going to get for a month. So if they have no other If they just have SSI benefits, and nothing else playing into that, whether it's work, mostly work, they're going to get that $841. So once we get to that, if the number is under 841, essentially that child is eligible for SSI. If it's over, then they financially wise, they wouldn't be eligible. And then if it is denied for that reason, you can go, there's always an appeal process. We're not going to dive too much. We're not really going to dive much into appealing, other than, really if it's something that you can justify and show, it's worth it. For instance, a few months back, I did one for somebody who had a big SSI take back, and I broke down on a spreadsheet of, because they were counting the stimulus checks. So the stimulus checks didn't count for a year, and Social Security was counting them in a couple months and asking for that money back because they thought that the person was overpaid. So I had to justify and show that stimulus check was being counted, and Social Security looked at it. They said it was their mistake, and the appeal worked. So it does help in some cases to go through that process, and also I think it gives you a better understanding of what Social Security might be looking at, so then it makes each time a little bit easier. But back to this, so if the remainder is under that 841, the child would be eligible for that SSI, and they're going to receive the difference in the benefit payment. And we're going to look at that right now. So here's an example of deeming. Parent makes $3,000 gross earned income and has 2 children at home. One has an autism diagnosis and one does not. So Social Security is going to start by subtracting $420 for the child without autism, which leaves us at $2,580 is a new gross monthly income for that person. So this is the new amount that Social Security is going to look at. From that, we're going to take out that first $85 that they're always going to take out, brings us back down to that $2,495. Then Social Security divides that by 2. So now the only gross monthly income that Social Security is going to look at is $1,274.50. And then, since this is a one-parent household, we're only going to subtract 841. So remember, if it's a 2-person household, we're going to subtract that higher number, which was 1261, I believe. But it's only a 1-parent household. We're going to subtract 841 for a 1-parent household, and that brings our balance down to $406.50. And that is a lot less than 841. So financially, that child is eligible for SSI, and they should receive a SSI check for $434. So we're going to take that 841, that federal benefit rate, subtract this remaining amount, that 406, and that's how we get that 434. So once SSA deems that income from the parents, they don't, like I said, they're not going to look at all of it. A lot of it's kind of cut out because they know that there's other people in that household. They know that there might be, obviously, you and a spouse are going to need to be paying for things for yourselves and things for your other children. And then they always only count half of whatever that is. So even if you're working and you're submitting pay stubs, they take out that $85, they divide it by 2, and then that balance is going to be whatever your SSI payment is going to be for the month. So it works all the way through when your child turns into an adult, and if they still need to receive that benefit, it's going to be the same process. So this child here, 1-parent household with a sibling, should receive an SSI. It should be eligible for SSI financially after looking at the parent's income, and they should also receive a benefit check for about $434. So that's deeming and what Social Security looks at when they deem a family's income. They'll talk about resources, and Social Security also doesn't count a lot of resources or assets. Like the home that you live in doesn't count, the car that you drive doesn't count. and they're on the same website where the definition of disability is. They kind of go through what Social Security will look at and will not look at, or doesn't look at. So this, so this page here kind of goes through SSI and kind of what we just spoke of, who is eligible, deeming criteria, like I said, the criteria. So this is all that deeming part, and it kind of breaks all of that down for you a little bit as well. Again, I feel that the Social Security website, as bulky as it can be, does have a lot of good information on it, and it's usually fairly easy to read and understand as well.
So 2 questions. If the family situation changes, parent gets married, do you have to go through the whole process again? That's the first question. And then, I work with children whom the hope is with therapy, the disability will not be impacting forever. For example, children who are deaf or hard of hearing receive speech language therapy with the hope they will reach within normal levels. How might that impact the process?
So that the last one, I mean, that kind of goes back to that definition of a disability. So, if the speech and language therapist can show that the disability is going to last at least a year, and that it is currently impacting, the child's day-to-day life, they can still get that disability determination. And I didn't mention it yet. So each year, when somebody does have that disability determination, typically it's yearly. I truthfully think, again, with COVID, it might be not as frequent, but typically yearly you'll get, it's called a continuing disability review. So Social Security will send you a form to fill out, and it's all information, a lot of the same information that you'll, not as detailed, but a lot of the same information that you'll go through when you do your application to see if that disability is still as prevalent as it was when they got their determination. So if there is a chance, yes, absolutely, there is a chance. And I mean, also, that's kind of the hope for all of the children that we support, that, we can get that early intervention and get that support and have them able to, go to school and have the best life that they've ever had. That's ideally, where we want to land. But so you'll have a continuing disability review sent to you yearly at least. And that will kind of determine if that disability is still affecting the day-to-day life as much as it might have been before. So there is a possibility that, down the road with therapies and interventions and everything, the disability may not be there, and that's okay. And if it gets worse again, you can reapply. If somebody gets married and their living situation changes, you just report that to Social Security. I have that in a little bit. We'll touch on that. You don't have to go through the whole application process again. You will send in, I don't know if they ask for like a marriage license or, that sort of thing. But you will have to go through the financial piece again, but it's not the whole application. So you report that change to Social Security, most likely send in pay stubs, and Social Security will do, the process that we just spoke of, break it down. And, if it's a drastic change with the gross monthly income, if it's a lot higher, the benefit might be paused. There's a couple other things that, you might be able to look into, like a spend down where you can submit medical bills to keep that Social Security, and if he or she has Medicaid, keep that Medicaid in place. But yes, if a living situation changes, we do want to report that to Social Security. And I have that in a couple slides, I believe, and I'll show you the portal where you can submit that. I've had a lot of families, say that portal is pretty user friendly. There's a couple out there that are not, but a lot, I've heard pretty good positive reviews for the Social Security online portal for once you're in action, so like once you're ready to submit things, that's fairly user friendly. Yeah.
And then another question that came up was, What if your income varies from month to month?
Gonna kind of be that same situation where if it's a big variance, if it's a couple $100, it probably won't be won't make that much of a difference in the benefit amount. So initially, when you do that first application, I believe that Social Security is going to take the average of what you make in the household, and then monthly, if your income does vary greatly, that same way you can report those changes online through the portal, through their online portal, and submit any of those big changes in income that way, and they can adjust your child's benefit amount from there. Just a couple other side notes with applying for SSI. I've had quite a few lately child support questions, so just a couple general things with that. Social Security SSA will only count 2/3 of a child support payment as unearned income for the child. So they will count part of it when they award the benefit amount, but they only count 2/3 of it. Separated parents, if you have one parent who is not living in the home anymore, Social Security only counts the custodial parent, which is the parent who the child is living with. If the child support, so ways you can get around that child support not counting. However, I understand that people need that child support to live. But if the child support has a court order to go to a special needs trust, Social Security wouldn't count that against the child as unearned income, and that would give the child that trust there to also, which can help them down the road as well. And the last big thing when applying for that SSI, remember just that you're showing Social Security the support that your child needs. Make friends with those doctors, those therapists, those teachers, so that they can really help Social Security show how much support that your child needs. A couple benefits of having benefits. It assists with obtaining Medicaid. We're going to talk about that here next. Unfortunately, in Missouri, they are two separate applications. In 44 states, they all flow together. But unfortunately, Missouri is not one of those. But it will assist because the applications are very similar. And Medicaid will know whether or not that SSI benefit's in place. It assists with extra funds for your child's expenses. And then also it's easier to reapply when they turn 18. When they turn 18, they just have to reapply as an adult. That deeming piece comes out. And so they're no longer looking at that financial piece of the parent. And then also having that disability determination in childhood. If the disability continues into their adult life, that can help them receive childhood disability benefits, or CDB benefits, which is a benefit off of the parent's retirement. When they retire or pass off of their Social Security benefit, the child can pull their own benefit off of that to help keep them supported throughout their adult life. So we're going to flip over, take off Social Security and SSI for a minute, flip over to Medicaid and CHIP. So CHIP is Children's Health Insurance Program, and it is a extra benefit or extra health insurance for maybe for families who make over that Medicaid amount, but still, they have a child with a disability and they still need that extra support. So in Missouri, Medicaid is called MoHealthNet, so you might hear those interchanged, being used interchangeably. And like I said, it is applied for separately from SSI. Applications are taking longer to be processed, so be proactive in this. I just last week read an article where in Missouri, they're taking up to 70 days, where the average is usually 45. So Medicaid applications with Medicaid expansion coming up and just more people applying are taking a lot longer. So I hate saying it, but do your best to stay patient. Medicaid, just like Social Security, is going to do most of their communication via mail. So keep your eyes out there. Having SSI in place can help with that eligibility. The applications are very similar. And then, like I said, CHIP is called the Children's Health Insurance Program. It provides health insurance to the families that might earn too much. And with CHIP, the families, if they are earning too much, will most likely have a premium that they pay in to have that coverage. You can apply for coverage online, via phone, at the local Medicaid office as well. So here is just applying for that Medicaid or for Mo Health Net. So applying for Mo Health Net, this is all going through DSS, Department of Social Services. So here, just an example of what that first page is going to look like. Talks a little bit about Medicaid expansion. Like I said, that is making applications a little bit longer to be processed. So you're going to apply here. You can apply online. You can print off an application and submit it, or you can apply by phone. Online will give you the ability to check the status of your application a lot quicker, rather than calling and sitting on hold to try to talk to somebody to check that application. So if you do want to apply online, like I said, you have that ability to check the status of your application that way. Really important when you are filling out your application to fill out that supplemental form here that's on number 2. And this will go into more questions about the disability for the person that you're filling it out for. Remember to use your child's information. Back here on the first application page, at the very bottom, I think it's called like Supplement C or Appendix C. It'll go through if you're filling it out, if you're filling out an application for somebody else, it has all those details. So Medicaid will know that somebody's filling this out for this child, but just making sure that we're putting that child's information in there as you're filling out the application, and then filling out that last section, Appendix C, like I said, saying that you're filling it out for somebody else. So like I said, so we just looked at that application website, which is there on that top note there. Making sure that we're using your child's information, and then filling out the Appendix C at the end of the application, which is the one that shows that you are filling it out for somebody else. And then filling out that supplement for people with a disability. So that's going to get into some of those questions that you probably had literally just done with the doctor and the therapist. Like I said, they're very similar applications, but that will show that extra support that the person needs. So that will give you that Medicaid or Mo Health Net insurance as a health insurance. So helping, pay for those doctor visits, some therapies, whatever that might look like for you and your family. Cool thing with Medicaid, once you have that in place, are Medicaid waivers. So you might also see them called HCBS waivers. In Missouri, we have 4 main ones that we use. So for a Medicaid waiver, you do have to have Medicaid in place to apply for them. Also, you have to have support coordination through DMH in place, or regional centers used interchangeably. And that support coordination support coordinator will help you get on a wait list for the waivers to help you receive more support, which we're going to talk about here on the next slide. So home and community-based waivers or HCBS waivers are all listed here. For children, really any of them, you could be on the wait list for. Biggest one is this first one. It used to be called the Sarah Lopez waiver. Now it's called Missouri Children with Developmental Disabilities, or MOCDD. It can help you cover behavior therapy, crisis intervention, respite, personal assistance, any specialized medical equipment they might need. And then who is eligible here down in the green? Children until 18, receive those DD services. So that's that support coordination piece. And then it breaks down the other three that are available. The Partnership for Hope has a lower service limit per year. Looking at that now, thinking it may not be updated for 2022. So that might be a little higher in 2022 here. But it can cover even more services there. ABA, you can get that dental piece in there, OT, speech, transportation, which probably isn't going to apply much. And then the last two are going to, kind of apply more as your child is growing and becoming a little bit more independent. It has that day hab in there, has more of the transportation, job development. If you do job development through DMH versus through Volk Rehab, they can help cover, those as well. So Medicaid waivers or HCBS waivers can help greatly, kind of cover therapies and cover those extra expenses that are coming in. So once you have Medicaid in place and you have that support coordination, going in and getting on a wait list for those waivers, they only unfortunately release so many per year. And it varies. It changes, sometimes month to month, it seems like. But so that's what the Medicaid waivers are. So like I said, we do want to have that Medicaid in place. If you've applied for Medicaid and you've applied for Social Security benefits, it might be a good idea to call the regional office and speak with an information coordinator and just get that support coordination kind of rolling. And until you actually have Medicaid, I don't believe they actually assign a support coordinator to you. But if you talk to an information specialist, they'll be able to get that on the radar for when Medicaid is in place. So that's Medicaid waivers and applying for Medicaid kind of in a high level nutshell. We looked at that application a bit, or the steps for the application. Reporting to Social Security, we touched on this a couple minutes ago. We want to make sure if that gross monthly income changes, we're reporting that. If somebody moves in or out of the house, or if you move, period, if you move down the street, move across the town, whatever that looks like, address changes. I'm going to show you, we're going to flip over and look at that online profile on their portal, or the portal there. And here's that website for that. So here we have still on that SSA, that Social Security website. And so this is all their online services. So here's the portal piece that I was speaking of. You can go in and you can create your account, sign into your account. When you're there, lots of different things you can do. You can look up the status of an application. You can use it to appeal if you have to appeal something. You can do all that managing your account pieces. So that address change direct deposit information. If you ever need to request a Social Security card, you can do that here. So lots of different extra pieces on that Social Security portal that can help you submit things in a more timely fashion and hopefully get some responses a little quicker. So that's reporting to Social Security. Super important that we're doing it, to avoid those overpayments or even the changes. If somebody has been doing great in therapy and they do that continuing disability review, maybe that disability isn't as prevalent in 2, 3, 4 years. That's kind of the purpose of doing everything that we're doing, right? I want to touch a little bit on ABLE accounts, but ABLE accounts are a great way for anybody with a disability to save money. So with Social Security, with SSI, there is a $2,000 asset limit. So folks who have that SSI benefit shouldn't have more than that $2,000 in assets at any time. So for a lot of our folks, if they are accumulating more money, those ABLE accounts are a great way to save money. So they're kind of like a 529 college savings plan. So the money is in there, it can earn interest. And there's small monthly fees. It's actually, I think they do it by a quarterly fee. It's $9.75 a quarter. But it's a great way to keep your person's money in an account, and that money can be used for qualified disability expenses. So that can range from rent and housing expenses, daily living expenses, medical expenses, communication devices, any kind of support things that they might need for school. I'm going to flip over to show you that website here because it has a lot of good information. So here, just general information about the account itself. This is where I wanted to go, qualified expenses. So this talks about what the money can be saved on, basic living expenses, housing, transportation, education, legal fees, burial plans. That's not something that we always want to talk about, but it can be used for that. Assistive technology is a huge one with a lot of our folks also. So on MoAble site, it'll take you through what it is, all the ins and outs of it, and can help you open an account there as well. Next, we have just a quick summary of everything we talked about. Communicate with those doctors, therapists, and teachers when applying for benefits. Use them. Let them know that Social Security will be sending in documents for them to fill out, and follow up to make sure that they get filled out. Really keep those communication doors open. I think that's the biggest thing to help not get denied that first time, especially, because those denials don't help. They can be very, very off-putting and just, kind of beat you down a little bit. But, use those people, get those in place, get those documents submitted to really help show that your child needs that support. That goes into that next one. Show how your child needs the support. Submit those documents showing limits, whether it's medical records, whether it's their IEP, anything that will support the support they need. Even if you think you make too much for deeming purposes, still try to apply. Like we talked about, Social Security doesn't count nearly all of your gross monthly income, so you might be surprised. Medicaid, similar process when you apply for Medicaid as for Social Security. Unfortunately, with that, just be prepared to wait until all the Medicaid expansion slows down and they can get caught up. Once you have that Medicaid in place, that calling Regional Center or DMH and getting that support coordination in place to get on list for waivers to help pay for those therapies and respite, and then help save money with an ABLE account. It's a great place to put extra funds for your child as they accumulate, and then can help them with expenses as they come up as well. And that is all I have. So, Anne, do we have any more questions there?
So the first question was, does a retirement account affect income? I don't think I can access the money in the account early.
Not all retirement accounts do. You are correct. But no, if you can't access the money, if it's something that's not accessible, they won't count it. Retirement accounts aren't touched on this list. However, if you don't have access to it, I would believe that it would not count. That might be a Social Security question.
Yes, I would think that it would depend on if you can access it with penalties or if you can't access it.
It doesn't say specifically for retirement funds, but like Anne said, I think if you can't access it, period, it wouldn't count, or with a penalty. That unfortunately would probably be a direct question to Social Security.
The next question is, on the SSA website, to begin the SSI application process, one would click on applying for disability, correct?
Mm-hmm.
On that website? Yeah. Okay.
You have something that comes up, give me a call and I'll do my best to help you out. A lot of, if it gets into like kind of legal stuff, attorney stuff, I'll do what I can. But that general information and those deep digs, we can definitely work on together. And questions, just general questions. If you even just want to talk through something, always feel free to give me a call, and we can kind of walk through stuff and figure it. And I can help you figure it out over the phone, or we can set up a Zoom, whatever works for you and your family.
Thank you very much, Kristen, for being here, for answering questions, for sharing information.